Welcome to the Nightingale Awards for Nursing Excellence, celebrating 25 years of honoring exceptional nurses. The School of Nursing's Board of Visitors began this tradition in 1989 as a way to recognize the remarkable women and men in the healthcare profession, and has evolved into a distinguished event that not only applauds the valiant achievements of notable nurses, but also raises funds for scholarships, modern equipment, technologically advanced simulators, and faculty research. Maggie Allesey is one of the founders of this event and original member of the Board of Visitors, where she remains an active and integral part of the school.
It's really exciting to be celebrating our 25th anniversary for the Nightingale Awards. This started in 1989, and we started out honoring just 4 nurses then. Now we're up to 9 nurses each year getting this wonderful award. The way it happened to start was we had a new group of people just for a few years that were learning all about the School of Nursing, and we were called the Friends of the School of Nursing. And one of the things that we were trying to do was to honor an outstanding nurse at the end of each year. So the only way we could have any money to do this was we finally passed the hat amongst the board members. There were 10 of us, so we figured if we put in $50 each, that we could give a nice $500 gift award for the person who was the winner, and that's what we were doing. Then our dean, our wonderful dean, Andrea Lindell, was out in Denver, Colorado at a conference, and she learned about the Nightingale Awards, which they were doing out in Denver, and came back and told us all about it. And we thought, goodness, wouldn't that be wonderful if we could do that and raise the money? Then we could not only give $500, but maybe a whole lot more to people for scholarships and people who are just getting awards for having been good nurses. So that's the way we started with our $1,000 award called the Nightingale Award, and that was the way we began.
Nurses consistently balance the art and science of healthcare delivery, delicately blending theories, practice, technology, compassion, and caring. The job is not easy. There is not always thanks involved, but nurses do it because they feel a calling to serve others. The nurses who have received the Nightingale Award have taken their responsibility as a practitioner to another level. These healthcare professionals see a problem and seek a solution. They take time to connect with their patients. They improve policies and procedures. They share their hearts and their minds, changing and improving the lives of many.
People were really reluctant to understand what we were doing, but after they finally realized the importance of nurses in our community, they really wanted to have someone from their hospital or nursing home to be someone who was selected. So we get many people are nominated every year for all the 9 positions, and we're so proud that it's continued to now 25 years.
We as nurses continue to be the hands, the arms, the feet, and the hearts that patients and the community see on a daily basis. My personal and professional commitment was renewed and refreshed by the receipt of this award in 2006.
Receiving the Nightingale Award was such a great honor. I still remember the night in 2001 when I stood on stage to receive the award. I am blessed with so many people who made it possible for me to achieve my best. The award is validation of the generous support I received from fellow nurses, the nurturing work environment at St. John Oakland that fostered professional growth and emphasized Christian values, the inspired leadership and mentoring I received from my supervisor, Kathy Gaffney, the education I gained from Oakland University, and the values my dear family instilled in me.
Winning the Nightingale Award meant the world to me. I had been a nurse for 16 years. I received the Nightingale Award for all my work in parish nursing in the Detroit area.
The Nightingale Award gave me motivation to improve my art and give back to the profession I am so passionate about. The Nightingale Award has validated excellence in nursing and has given me the energy to give back to patients, students, and my colleagues.
I keep the statue of Florence on the credenza in my office, and I see her almost every day as a reminder of the work and the sacrifices of the men who have gone before us, as well as her leadership. It has been said that 1,000,000 candles can be lit from one flame.
Receiving the Nightingale Award was quite a surprise and an amazing experience. Newspaper ads and billboards placed by my employer brought notes and phone calls from patients I'd care for, telling me how my care had made a difference to them.
Winning the Nightingale Award was one of the greatest days of my life. The award gives credibility and credit to the caring role the profession of nursing deserves. In my view, I didn't provide any better nursing than other exceptional nurses who provide loving, caring health services every day. I simply loved what I was doing.
Winning the Nightingale Award was one of the most exciting moments of my life. For me, this recognition validated my great passion for nursing and that sacred relationship between the nurse and those we serve.
We have proudly displayed my Nightingale statue on the mantle above our fireplace in our living room. I am so humbled and proud to have won this award, and that pride stays with me daily.
The Nightingale Award is the ultimate acclaim in the nursing profession. In the past, my Nightingale Award sat elegantly on my desk. Her placement was significant as she greeted all who entered my office, physicians, colleagues, staff nurses, families, which gave me the opportunity to speak about nursing. Just her presence resulted in respectful communications and teamness.
I remember how grateful yet humble I felt joining the company of so many outstanding winners who preceded me.
Along with several others, I have co-authored and published a book entitled Taking Care of the Uninsured. I've also written and published several articles. But more importantly, I've deepened my knowledge and understanding of the connection between spirituality and health, or that body, mind, and spirit connection as being foundational to the healing of the sick patients and of our communities.
Loretta Davis, Steve Gold, and I led the American Cancer Society's Cancer Prevention Study, CPS3, in fall of 2011, enrolling 727 participants in their first ever Southeast Michigan community enrollment. To date, over 113,000 participants enrolled nationwide, and one day they will reach their goal of 300,000 enrollees.
For me, this was a reminder that what we do isn't just a job, we really can make a difference in someone's life, often without our even knowing we did so.
Receiving the Nightingale Award was the pinnacle of my nursing career. In my service as Chief Nursing Officer for Providence Hospital and Chairperson of the St. John Providence Health System CNO Council, my award served as a constant reminder of the importance of nurses in healing the body, mind, and spirit of those entrusted to our care. My Nightingale statue, prominently on display in my office, served as a daily reminder of how fortunate I was to be a nurse and how blessed I was to be mentored by so many gifted and compassionate nurse colleagues.
The Nightingale emphasis led to many funded nursing care studies of mine and hundreds, literally, of publications. Oakland University's benefactor, Dr. Maggie Alessi, then endowed the Maggie Alessi Professorship in Geriatric Nursing Research, the one that I have been most honored to accept.
I became the Vice President of Patient Care Services and Chief Nursing Officer of Henry Ford West Bloomfield Hospital. I have also been honored to be a board member for the Association of Women's Health, Obstetric, and Neonatal Nurses for 4 years and am now on the Board of Visitors for Nursing at Oakland University.
Currently, I am working at Great Lakes Caring Hospice and Palliative Care Company. I am one of their new hospital clinical liaisons serving the Oakwood healthcare system. I am privileged to work and care for dying patients and their families. It is an honor to help these patients have a peaceful and comfortable death and normalize the dying process for their families.
When I began my nursing career 31 years ago, babies born at 30 weeks gestation or 10 weeks early did not have great outcomes. We did the best we could with technology available at the time. Attending the funeral of a patient born so small was sad, but now babies born at 24 weeks gestation or 16 weeks early survive and grow. This past summer, I was invited to meet the groom and attend the wedding of a 25-year-old bride on the beach in Florida. Jenna was one of my patients 25 years ago. She was born tiny and frail at 30 weeks gestation. Both she and her mother needed quite some time with intensive care. Through the years, I was blessed to remain a part of their lives. What an honor to be asked to witness such an important event. All because I was a nurse at the bedside, doing what I love, caring for my patients. My achievements since receiving the Nightingale Award are as they were at the time, making a difference by being a nurse.
Over the last 25 years, nearly 400 nurses have had the honor of being a Nightingale Award winner or runner-up in a variety of categories.
The 4 categories that we used to start our nursing awards were administration, education, staff nursing, and long care nursing. At the time, we also had different organizations who would donate $1,000 to be given for each award. Sometimes we didn't have people to give these donations, and I can remember even giving one in memory, in honor of my mother and Bob's mother, because we didn't have people at that time who were that much supporters of nursing. But now we have 9 people who get the nursing awards every year, and we have wonderful, wonderful supporters for the School of Nursing and have no problems getting support to give our awards.
And more than $1 million has been raised.
One of the things that we're so happy about is with the growth of the scholarship funds, we are now able to give 5 full scholarships every year, in addition to all the 9 people who win the $1,000 awards for being outstanding nurses. We've raised over $1.5 million over the years with our program, and we support research programs, faculty programs, and lots of things that are needed in the School of Nursing, which the money is there to help when it's needed.
I would like to thank Oakland University for recognizing excellence of the art of nursing, the art of human caring, and helping people to optimal health. Florence would be pleased with your dedication in preparing future nurses and inspiring them not to settle, but improve.
I would like to thank Oakland University for offering this award to honor nurses. I am proud to say that I am an OU alumni, and I still love being a nurse.
I want to applaud Oakland University for providing the most recognized celebration of nursing. And I thank God every day for leading me into a profession of service to others. Little did I know how much my life would be rewarded by being allowed to enter into such a sacred and intimate human relationship as the patient and the nurse.
I am grateful for the recognition that in my own small way, I have made a difference as a nursing professional and Oakland alumna. In the spirit of the Nightingale Award, I commit to support, nurture, and inspire other nurses to reach their best potential.
Thank you, Oakland University, for continuing the tradition of conferring Nightingale Awards to nurses in southeastern Michigan. Congratulations to the awardees and the nominees of today, because you are all heroes by continuing the excellence that Florence Nightingale so nobly advocated for and demonstrated in her work. May all of us keep the fire burning in serving our communities and light the fire, the candle of nursing for others along the way.
I would like to thank everyone, including the Nightingale panel, and especially Dr. Maggie Allesy, for making all of this possible. Thank you.
In the words of Florence Nightingale, let whoever is in charge keep this question in their head: how can I provide for the right thing to be always done? My Nightingale Award urges me to always do the right thing, to strengthen nursing as a profession, and to create an environment that will allow nurses to flourish. Thank you, Oakland University School of Nursing, for being the founders of such an inspirational award.
I just want to say thank you to all of you for coming tonight. You're here with us celebrating a wonderful 25 years of celebrating nurses. It's exciting for us to have it grow for so many years, and now we have a new dean. Dr. Carrie Schuling is helping us carry our program on. Thank you, all of you, for being here and making our program a success.